Hello all. Injecting dermal fillers has tremendously increased in the past decade for facial rejuvenation. But as customers, you need to understand what can be the complication if not done properly. Even though it's a minimally invasive procedure, still the risk remains as the needle penetrates your skin. I am Dr Sandhya Bala, a consultant plastic surgeon with 18 years of experience in facial aesthetics, being fellowship trained in facial remodeling. Today, I am speaking about the complication of dermal fillers. So the following helps in understanding if you are getting the right injection in the right side of your face by the right person. So first and foremost is the analysis of the face. So it starts with what is your main concern. Is it that you want to enhance your lips, or you want to erase the tear troughs you are having, or you are bothered about your sagging cheek, or you need more definition of the chin and the jawline. So your injector would judge the areas of volume loss. He would judge the skin laxity, the asymmetry of your facial angles and muscle activity. He or she would take a few pictures before actually injecting the fillers and discuss with you about what can be achieved with certain volume of filler. In dermal fillers, understand that less is more. You can always go for a touch-up or more volume if you are unhappy with the primary results. Dissolving excess filler is not as controlled as injecting it. So once the volume or the ml is decided, next comes the product you are choosing. Remember that you are injecting it inside your body, so don't ever compromise on the quality of the products. So some of the good approved brands are Juvederm, Restylane, Sculptra and Profilo. So based on the cross-linking of the hyaluronic acid molecules, the consistency of the gel varies. So it can be very thin, for example in a Juvederm Volift or Volbella, or it can be thick in Juvederm Volux or Voluma. It also determines the site where it has to be injected. A Juvederm Voluma or Volux is injected deeper down, close to the bone to give that volume of the bone, whereas a Volbella or a Volift is injected more superficially, for example in a lip or a tear trough, so that you don't end up in lumps and bumps. The third most important aspect that you have to consider is the injector. This is the most important factor for determining your final result. Always look for an experienced medical injector like a plastic surgeon or a trained dermatologist for doing filler injection rather than a beauty therapist or someone who calls themselves an aesthetician. Medical degree helps in understanding the facial anatomy very clearly inside out to understand where the blood vessels run on the surface, where are the nerves, what are the levels of facial layers and where the injection has to be given according to the volume deficit. Apart from the medical knowledge, it is also important for the injector to have a very keen artistic eye of the facial aesthetics. He or she should know where to place the filler, the right volume of filler to place and the right plane of the facial to place the injection to give a very good aesthetic result. A dreaded complication that people fear the most is they can end up having a duck lips after a lip filler injection. This can occur if too much filler is injected into the lip and sometimes if it is injected in a wrong plane of tissue. This is because lips is a structure which is in constant movement and the excess filler can actually migrate to the upper part of the lip and settle there and give the appearance of a duck lips. Too much massaging post lip filler injection can also give the look of a duck lips. Lumps and bumps on the lips or any other areas of the face can also be visible due to injecting the filler too superficially or sometimes injecting the wrong type of filler. Occlusion of the artery and skin necrosis and other major catastrophic complication, though it is rare, that can occur if you have an abnormal anatomy of the blood vessels or the injection technique is wrong by your injector. So post-procedure, what is the care you need to take after a filler injection? So after a filler injection, always you can use gentle cold compresses on the area of the injection. Always avoid sauna, sunbathing and strenuous exercises for a week. Avoid facial massages for 2 weeks. Don't massage the treated part aggressively and distort it. Also, before filler injection, you need to take care of certain things. One is stop all the medications that can cause thinning of your blood like aspirin, garlic pills or some herbal blood thinners to reduce the chances of bruising following a filler injection. Remember that hyaluronic acid dermal fillers always absorb water over the next few days and swell up. So see for your end result after a week, and later you can decide for a touch-up. So summarizing on how to get the dermal filler done rightly, it's important to choose the injector wisely. Don't compromise on the quality of the filler, and also in fillers less is more, so you always go for a lesser amount of filler injection. You can always give a touch-up later on. I hope you found this video useful. You can follow our channel The Science of Beauty for more such informative videos on plastic surgery and aesthetic surgery procedures. You can also follow us on Facebook and Instagram. Thank you.